Back in May, Scott Schoen was exercising when symptoms came on suddenly.
I felt sweats, chest pain, and a little bit woozy. I thought it might be COVID.
He called his doctor, who told him to go to the hospital right away. He was diagnosed with an aortic dissection, a tear inside the main blood vessel, sending blood to the rest of the body, and he needed emergency surgery.
We say the rate at which somebody will be lost, where they die, is 1% per hour.
Dr. Dale Adler is executive vice chair of the Department of Medicine at Brigham and Women's Hospital. He says Scott made the right call, but not everyone does. In a recent study, Dr. Adler and his colleagues reported a dramatic drop in patients delaying cardiac care at the 15 hospitals in their system.
We saw that the admissions for cardiac issues were down over 40% during the time when there was a COVID surge. We become very concerned if those people who have early signs that could be attended to are not really paying attention to them, or are paying attention to them but are so fearful of coming in that they stay home.
Since the surge, the positive test rate for coronavirus has dropped more than 90%, and Boston hospitals are taking precautions to keep patients safe, but the clinics are not filling up.
Though we've seen the regular flow of patients increase, we haven't seen an increase that we would expect.
Dr. Thomas Gleason is chief of the Division of Cardiac Care. He says it is safe to come to the hospital, especially with symptoms like Scott's. Dr. Gleason replaced the torn portion of Scott's aorta and says his prognosis is good.
To his credit, he didn't delay in coming in, and his decision to do so saved his life.
As chair of the board at Spaulding Rehab Hospital and a trustee on the Mass General Brigham board, Scott knew about and felt confident with the safety precautions in place. He says he feels lucky to be alive.
I think it's almost a certainty that if I hadn't gone to the hospital, I would have died.
So to ease any lingering concerns, the Brigham has developed a safe care commitment. It outlines the steps they're taking to keep patients safe. That includes screening employees and visitors who come to the hospital, adding hand sanitizer stations, and requiring everyone to wear a mask.